Is it time to call out the elephant in the room? Is it time to say that zero COVID is a myth and the time has come to live with COVID, and to say that is not insensitive? I'm Barkha, you're with the Mojo Story. We'll be talking to two very, very renowned experts who've been making that argument in a moment from now. Let's take a look at our big story today. Omicron and the third wave, though highly transmissible and high in terms of the number of cases, is not high in terms of either fatalities or the number of hospitalizations. Yet, although restrictions are being slowly lifted, we still don't have a uniform national policy either on schools and their reopening or on lifting all economic restrictions, including the opening of restaurants and abandoning quarantine institutional rules for international travelers coming in. Now you have two leading experts, Kiran Shaw and Dr. Devi Shetty, calling out these restrictions and saying the time has come to live with COVID. And they will be telling us in a moment just how to do that, keeping science at the heart of their suggestions. It's great to see both Ms. Shaw and Dr. Shetty on the program. Kiran Shaw, of course, is the chairperson of Biocon. Dr. Devi Shetty is one of our best-known doctors, but he's also, of course, apart from being the chairperson of Narayana Health, a member of the Supreme Court Task Force on COVID. So welcome both. Dr. Shetty, I think I'll start with you. Many of us had the chance to read your excellent article where you made exactly this argument that it was time to review several of the policies. What gives you this confidence? A lot of people are extremely paranoid, and both you and Kiran have been calling for an end now to the paranoia. So first, explain to our audience what gives you the confidence to make this argument, sir.
When the Omicron started, we were all very nervous, extremely nervous, because whatever the initial report came from South Africa was really scary. But over a period of time, as we started looking at more and more patients, as it became a more common virus, we realized that it is a lot more benign than what we thought. It is infectious. It spreads very, very fast. Virtually in no time, the entire family gets infected. But what we find is that number of people who require hospitalization, number of people who require ICU care is extremely, extremely small. Following our Delta experience, we virtually converted over 1,000 beds to accommodate as many COVID patients as possible in a COVID ICU setup. But today we have only 26 patients, and that too, most of them don't even need to be there. So this is the situation, and I keep monitoring what is happening in other parts of the country. Same story, COVID ICU beds, majority of the COVID ICU beds are empty, both in government and private hospitals. So this gives me the confidence that this virus is dramatically different than the Delta we dealt with.
Dr. Shetty, that is, of course, great news. And therefore, as one change that should come, do you think that the focus should stop being on caseload? And when we do the daily count, the focus should now be on hospitalizations and mortalities, because the caseload can be very misleading and panic creating, at least for ordinary people who are not experts like you and Kiran.
Yes, that's very important. We need to now convince people that we have to get back to life. I know it will take a long time. 2 years is a long time. We were tormented for 2 years. People overnight cannot switch their mind or their attitude. But we have to go in the direction, constantly projecting the number of COVID positive patients without really telling people that, look, yes, they are positive, but they're asymptomatic or mildly symptomatic. That message is not conveyed. Either we stop doing the routine COVID tests, or we, at the same time of presenting the positivity, we also explain how many patients are in the hospital. If we can do that, we can gradually build the confidence of people to get back to life.
That is such an important point that either we stop doing routine random testing, certainly for COVID, or if we do it, we need to start saying these numbers don't mean what you think they mean. Kiran Shaw, you've been making a similar argument and you've been urging state governments to stop this notion of night curfews, weekend curfews. In itself, in any case, it's unscientific because it's not as if the virus only visits only certain times of the day or certain days of the week. So it's to create the illusion of governments acting, but in scientific terms, it doesn't mean much. Are you sharing Dr. Shetty's optimism at this point about returning to life, as he calls it?
Absolutely, Barkha. I think Dr. Devi Shetty and myself are absolutely aligned on this particular aspect of the pandemic. I think that vaccinations have played an enormous role in muting the virus. So I believe that the fact that we have vaccinated our population at such a high level, I mean, today almost 70% of our entire adult population is double vaccinated. In Karnataka, it's almost 95% have been double vaccinated. So I think with such high levels of vaccination, I think we are in a much safer place. Now, constantly reacting to a new variant with a lockdown or a curfew is not going to, prevent infection rates. In fact, you just heard Dr. Devi Shetty saying that this Omicron virus is very transmissible, but it is mild, it is benign, as he puts it. And I personally believe that you've got to open up. I think you should be only testing symptomatic patients, if at all, because I think people are still worried whether they have COVID or not. But trying to go beyond symptomatic patients and testing the primary contacts and doing all this contact tracing that we're trying to do is unnecessarily creating panic. Moreover, I'm also worried that it's hugely disruptive. I mean, I'm sure Dr. Shetty will agree with me that in hospitals, a large number of nurses and doctors are absenting themselves because of either testing positive or being primary contacts. In our case, as a manufacturing unit, we are seeing large numbers of people absenting themselves because a few people have tested positive, and then we have to basically quarantine a large number of people whom they've been in touch with, and so on and so forth. So I just think that we need to be a little more, sensible about how we are dealing with the pandemic. As someone very rightly said, the Spanish influenza of the early part of the 20th century did not just go away because they did this aggressive testing. It's because people started basically living with the virus, and eventually it basically became a part of our everyday disease. And today the flu that we have is nothing but the remnants of the Spanish flu. So I'm also of the opinion that the COVID-19 virus is also going to mutate itself into a milder and milder virus, and we'll have to accept it. And for me, the greater confidence I have is that we have a large understanding of how to manage this virus. We
Yeah.
now have many, many interventions like drugs, like, we know how to manage the disease. We know that we have either antivirals, we have steroids, we have antibody cocktails, and so on and so forth. So why are we in such a stage of paranoia that if you get COVID you'll die? I mean, that's nowhere near the truth. Very
But
few
let me
people get a severe disease now, and even if you get severe disease, there's no threat. It's not life threatening. You can actually manage it well now because we understand how to manage the disease. It was very different in 2020 when we really didn't understand what was happening, but today we have a much deeper understanding of the disease itself.
Yes, of course, in 2021, with the lethal Delta wave hit us as hard as it did because we didn't have enough vaccines. Now we do. Kiran, one of the points you've made before I take it back to Dr. Shetty is that private companies such as yours should be free to give a booster shot to your staff to get those companies actually functioning. But in India, unlike elsewhere in the world, the gap between the second dose and the booster shot continues to be 9 months. In many other parts of the world, it's 3 to 6 months. I know a lot of the vaccine manufacturers have privately been expressing a certain amount of frustration over this policy. Do you think, as Covishield and Covaxin are about to get regular market nod, this policy needs to change of the gap?
Well, first and foremost, I think mRNA vaccines wane very fast, and that's why they've recommended the 6-month booster shots for many parts of the world. In our country, obviously, there have been a larger sort of gap between the first and second doses. But I, for one, feel that the 6 to 9 month window is good if you want to boost the immunity with a booster shot. Having said that, I think even if you wait for 9 months, it's not a wrong, sort of a mandate from the government. But I think basically, companies like ours want to make sure that we can provide booster shots to our employees just so that they feel a lot more confident and comfortable that even if they get the disease, they are not going to get severe disease. I think it's more from a moral kind of comfort factor that we need to give them these booster shots than really having. I mean, booster shots are not going to prevent infections, but it is very well known that both vaccines and boosters are preventing severe disease.
Now, Dr. Shetty, let me actually take the argument made by both of you further and say in plain words that what you're suggesting actually can't happen unless people stop panicking the moment somebody in a school, in a classroom, in a company tests positive. Unfortunately, what we've seen, Dr. Shetty, is that even in this third wave, we saw buildings being sealed, we saw companies closing down, we saw the default responses of the first two waves, even though we know so much more, even though, as Kiran said, we have so many more instruments to fight this. So here's my question to you. What should ideally happen in a workplace or a building, a residential building, if somebody tests positive? That's what most people want to know. And we need to be now able to say, it's okay. Are we at that stage?
Today, I just give you what happened in my house. In my house, my 4 children and their spouse and my 5 grandchildren, all of them got COVID in a matter of 2 weeks. And by the grace of God, without any fancy drugs, they all recovered. Simple painkillers and the fever medicines, that's all. So even the lay public today realize that COVID is not such a dreadful disease as it was before. And look at who should be more scared. It's the doctors and the nurses, hospital staff, because as the public, you are occasionally exposed to COVID, whereas we were living in the midst of COVID. Every other patient in our hospital during the Delta wave was a COVID patient. Today, I see senior doctors with just a N95 mask and maybe a visor. They walk around in the COVID ICU. Our nurses care for COVID patient as if he is like any other patient. So the understanding of the disease has changed, but that message hasn't reached yet the lay public. I think gradually maybe it's too premature. Another 1 or 2 weeks time, there should be very clear guidelines coming from the government when everything settles down, because a lot of the analytic models are projecting that there will be a high number in the first week of February and things like that. Okay, let's wait till that time. But at that time, there has to be some clarity on how do you deal with positive patients. Right now, if I express my views, maybe it will be looking like a very premature view. We will wait. Another 1 week or 10 days doesn't make any difference.
But the important point you've made is that in any case, the inordinate focus on the caseload itself is the wrong emphasis for where we are with Omicron. Let me ask you this, Dr. Shetty. One of the most disputed issues is the opening of schools. And, India has had among the longest physical school lockdowns in the world, despite the World Health Organization urging that schools should be the last to close. Now, I know that you, in particular, many of your hospitals are children's specialty hospitals, Dr. Shetty. You were among the first to call for vaccinating children. And we have begun to see at least certain age groups getting that vaccine. Are you confident in urging parents? Many parents feel they want to send their children to school. Not all parents are convinced. So we are not seeing a national policy on the reopening of schools. What would you say, Dr. Shetty?
First of all, as a doctor having special interest in children, I was mortally scared. I was mortally scared because we adults have protected ourselves with vaccines, and good number of us were exposed to COVID some point or other. But our children were totally protected from COVID, and I was really, really worried how children are going to behave. But fortunately, by the grace of God, even among the children, COVID with Omicron has behaved in a very, very benign manner. So it's not as serious as it was during the Delta wave. I am confident to say that it is safe to send the children to school, but I'm not saying that none of them will get infected. They will. Some children do get infected, so we should open it up gradually. Maybe alternative days children can go. Or I have my grandchildren. Some of them haven't. They are in second standard. They haven't gone to school even for one day. My granddaughter doesn't even know what school is.
That's so
So
sad. Yeah.
this is going to have a big impact on these children. So when they go to the second, third standard, God forbid, if you are not able to open now, they will be lost completely. And so this is what I was trying to say, is that at some point of time we have to say, like in the newspaper, we do come across a large number of articles saying that next wave is going to be dreadful and this is going to happen, it's going to mutate. Virus is going to mutate, it is going to be different. Nobody knows how it will be, whether it's going to be more dangerous or less dangerous. But thinking that something is going to happen after 6 months or 1 year, why can't we use this window of opportunity and try to get back to normal life as quickly as possible? Now, I know strong possibility. Reading the history, virus doesn't want to kill the host. It is the interest of the virus that the host doesn't die, because if the host dies, the virus is going to die. So every epidemic ended by gradually virus becoming less and less virulent. So why do we think COVID is going to be an exception? So my suggestion to everyone is that we now have a window of opportunity. Let's not worry about what's going to happen after 6 months with a new variant coming up. We don't know what is going to happen. At least now we make use of the window of opportunity we have. Open the school gradually over a period of time and let children experience what school is about.
Yes, and some of the surveys that show how children are losing cognitive skills, social skills, they're going silent, they're just not used to people of children of their own age group. They're truly alarming and actually could do more harm than at least this particular variant of the virus can, and that's what we have to convince parents. Kiran, we're days away from the budget, and we have not even begun to look for the damage that these continued restrictions will do on livelihoods. And yes, it's a kind of cliche to say lives and livelihood both, but right now there isn't enough emphasis on livelihood. What would you urge governments, both state and center, to be doing at this point?
See, we have to open up the economy. There's no two doubts about that. I mean, we cannot constantly have lockdowns and curfews and close up all establishments like restaurants and bars and tourism. I mean, these are not these are suffering. And you know that the biggest challenge we have as a country, there are many challenges. Inflation is one of them. Certainly, I think livelihoods are the most important, and job losses. I mean, look at the job losses that have taken place. And if you don't open up the economy, and if you're constantly going to have only work from home kind of models, then even the number of new jobs being created will be difficult. So I think
Yeah.
you do need to look at opening up the economy very, pragmatically. And I, for one, believe that we are in a position now to feel that we can actually open it up safely. Like Dr. Shetty said, you can wait for 2 more weeks if you want. I myself would be quite okay to even open it up right now. But if everyone is saying the modeling is suggesting that you're going to have a huge surge and there might be sudden hospitalization or whatever it is, I don't buy that argument. But let's assume that maybe some eventuality like that should be looked at. I
Yeah.
think just waiting for a couple of weeks, and if we don't see this kind of gloom and doom kind of scenario, then I think we must open up very confidently. I think many countries today are finally saying enough is enough. I think you look at the UK now; they are finally saying we don't want all these RT-PCR tests. If you're double vaccinated, come. Okay,
Yeah.
and I know
Yeah.
many people who went on a trip and they've contracted the infection on a flight, asymptomatic, but because they've had to test, they've tested positive. I know Dr. Shetty will also tell you that many cases of COVID at hospitals are being reported only because they've come for something else and they have to be tested for COVID. So they are testing positive. But I think, as Dr. Shetty said, where are the serious patients? Where are the ICU and the ventilator patients? We know that Omicron only seems to impact the upper respiratory tract. Upper respiratory tract infections are something we know how to deal with quite easily. So I just think we need to now get back to normalcy. I think we really need to start not feeling so panicky and paranoid, and let's open up, is my view.
And I think both of you are basically saying let's get into very specific things now instead of keeping it general. Do both of you agree that only asymptomatic patients, only symptomatic patients need to get tested, or would you take it further and say even those with mild symptoms do not need to go and get tested? Kiran, I'll start with you because one of the comments you made was, we're all used to, let's say, having a flu, having a cold, a bit of a body ache, a bit of a fever, but we've never shut down our lives because of it. Have we reached the stage with our vaccines, our booster shots, knowing how to manage this, where you are ready to say, if you are asymptomatic or if you've got mild symptoms, don't even bother getting tested? Kiran, I'll start with you first on
No,
that.
my view is that if you're symptomatic and if you're really worried that it could be COVID, then please test yourself. I mean, I'm even going to that extent saying that if you just got a cold or a cough, I don't think you should go rushing off, testing yourself for COVID. It may or may not be COVID, but if it's not so dangerous, then do you really need to test yourself? But if you are worried and if you want peace of mind, by all means, go and test yourself.
Yeah.
But I personally believe, at least to begin with, let symptomatic patients at least be tested. Asymptomatic patients need not be tested, is what I feel. And certainly, you should stop all this contact tracing and primary contact testing.
Absolutely. Dr. Shetty, if you'd like to add to that with one more question, there's now an argument that the CDC in the United States of America made when they reduced the self-isolation period. They said RT-PCRs can actually show you being COVID positive for much longer than you're actually, ill. So they reduced this. Would you also say that the RT-PCR as a way of testing, at least for the Omicron variant, needs to maybe stop at least at the end of your 5 days? I'm not saying in the beginning, but at least at the end. That's something maybe it's time to look at, Dr. Shetty.
Yeah, yes, Barkha, if you do the COVID test on the fifth day or seventh day, there is a strong possibility it can be positive, but you're not really a carrier, or you're not going to hurt yourself. So there is really no point in repeating the RT-PCR. Okay, you have diagnosed it, fine. After that, after 5 days, our health workers come back for work after 5 days. Others go back for work after 7 days, and that's fair enough. Barka, the other interesting thing I want to tell you, which is very important for people to know, today in the newspaper, they always project this many people turned out to be positive in state of Karnataka or West Bengal or wherever, and this many people died.
Yeah.
The meaning of died due to COVID today is totally different than the meaning of patient died during the Delta wave. During the Delta wave, when somebody died, if they died due to COVID, because hospitals were not doing any procedure, they are not admitting any other patient other than COVID.
Yeah.
Today, most hospitals are as busy as ever. And when we have a positive patient didn't come to us for the COVID. They came for an angiogram, angioplasty, or some procedure. And COVID is an incidental detection. If
Yeah.
you screen 100 people in the street today, 30% of them are COVID positive. And that doesn't prevent people from dying, right? So people do die due to so many other reasons. And if they happen to be COVID positive, it gets reported as so many people died due to COVID.
That's
So
such an
this is the
important point.
other message.
Yeah.
Yeah.
And can I ask you that actually, if our hospital and our medical system and our public attention remains focused on COVID, there's actually a greater chance that people who could die from other serious infectious diseases will not get the attention that they deserve, whether it is tuberculosis, whether it is kidney disease, or dialysis, a heart patient. That could actually be our next big crisis if we continue to obsess only on COVID, Dr. Shetty.
Yes. See, this has happened naturally because, as I said, we prepared ourselves for a huge number of patients. We even converted our entire nursing college as a COVID ICU bed. So essentially we have done all that, but we are sitting with very few patients. But during Delta wave, large number of patients suffered. Even today, large number of patients with a curable condition, whether it's an early cancer or a children with a heart problem who need surgery when they are 3 month old, 4 month old, that gets postponed for 6 months here because of the COVID. And when they come to us, they already missed the bus. It's very tragic, very, very
Yeah.
tragic.
Yeah, absolutely. Kiran, you were making the point about this contact tracing, needing to end. If we need to boost the economy and not just ourselves with the booster shots, institutional quarantine and even quarantining of patients perhaps now needs to end, because the original idea of quarantine was based on this test and trace model. The test and trace model may well be kind of have done its time, served its purpose, because Omicron is clearly in community transmission. Kiran, you're on
Notion that
mute. Yeah, go ahead. Yeah, go ahead. Yeah.
this notion that you have to quarantine people and get them off work and not sort of be in touch with anybody else, I think that has to disappear. As Dr. Shetty said, I think once you test positive, the moment you feel better, I think in 5 days time you should get back to work. I mean, in the past, whenever we've had flu, yes, you are down for a few days,
Yeah.
but the moment you feel better, you want to get back to work. And I think that's the way we should now take this virus. So I think certainly I'm completely of the opinion that this institutional quarantine has to stop. In fact, it's crazy. International passengers have to mandatorily quarantine for no reason. I mean, I think that's absurd. I mean, we cannot be forcing people, even if they are not positive, to go and spend 3 days or 7 days or 5 days in a quarantine center. That's ridiculous. So I think like I said, I don't think the virus understands passports or boundaries or I mean, let's face it. If you're going to get COVID, even if you come from the US, you have to transit through some place which is now being said. If you come from, I mean, it's absurd if you think that they say if you come from certain countries in Europe or if you come from South Africa, you have to declare your place of origin, and then you have to quarantine. If you come from the US, they're saying you don't have to quarantine. Now, come on. The place where you actually get infected is on the flight. Okay, the virus is not going to ask you where did you come from, what is your passport, and all that kind of stuff. So I think we are very unscientific about the way we are quarantining people. So I just feel you should stop worrying. I know I've had many friends and family members who have come from the UK when the Omicron was at its height, and they've had to be quarantined even though they were asymptomatic. So it's been a mess, I feel, and I think the world needs to now stop being paranoid. media also has to play its role in stopping this panic and paranoia, I feel, Barkha.
Absolutely, I agree with you. And Dr. Shetty, let's move on now to what the vaccination focus should be. And in policy, we have a few minutes left. So let me ask both of you. Dr. Shetty, let me start with you. Vaccine passports. Instead of closing restaurants or saying 50% capacity, would it not be better to say at the door? And a lot of countries in Europe are doing this. At the door, show us that you've got at least 2 shots of the vaccine and come on in. Because anyway, to eat your food, you have to drop your mask. Right? So masks in itself, at least in a restaurant, will not really do much. So I want you to talk about practical measures like this. Has the time come for vaccine passports to get into a restaurant instead of shutting restaurants or operating them at 50% capacity?
Barkha, whatever you're talking about the vaccine passport, it wasn't possible earlier, but today we are perhaps one of the few countries in the world which has vaccinated nearly 70%. Like in city of Bangalore, virtually every adult is vaccinated. We are privileged. So in this kind of a cities, I agree that we should really give some value to the vaccine as well. See, there are quite a few people even today, they are hesitant about the vaccine. Now, if you want to encourage more and more people to get vaccinated, best way is to give some benefit to people who are vaccinated, so that the vaccinated people can enter a theater, or they can go to a restaurant, or go by the public transport, right? So this way you will be able to encourage more and more people to go themselves and get vaccinated, because COVID vaccination is going to be an annual event. Yeah. It's not one of a booster or a third dose or a fourth dose. Every year we may have to vaccinate ourselves.
That's such an important point. Is incentivizing vaccines? Kiran, do you agree that the time has come to incentivize vaccines? And if what are some of the incentives that could be offered?
Well, like you said, obviously we should actually encourage, vaccinated people to be free to enter any public space or restaurants or airlines or whatever else that they have to be exposed to other people. And those who are not vaccinated obviously run the risk of catching an infection, which could be severe. So, data is also showing that those who have not been vaccinated might have a more severe reaction to an infection than those who are vaccinated. So I think we need to look at it in that form. I mean, that this famous controversy of Djokovic, who was not allowed to play the Australian Open, I think was the right thing to do, because he was he actually refused to get vaccinated and he paid the price. Okay. I mean, I think time will come when it won't be so severe a requirement, but at this point in time people want to be safe. I certainly want to be in a place where I know that everyone around me is vaccinated, and to that extent I think you need to incentivize vaccinations.
Okay, final comments from both of you. Something that needs to shift in the policy, you've already said, stop the testing, stop random testing, stop focusing on the caseloads, open schools, incentivize vaccinations. Specifically, if you had to make one recommendation that hasn't changed yet, but needs to, Dr. Shetty, I'll start with you.
See, more than the regulation, I would like our dialogue and our communication messaging should change, saying that time has come for us to rebuild the economy. That should be our priority, and all the right statements should be made in that direction, rather than keep on counting the COVID numbers. Yes.
Yeah, absolutely. The messaging is so important. And, Kiran, if you want to add to that, Dr. Shetty believes communication and messaging is where the biggest change needs to come. What would be your policy prescription as we close?
I would just say mask up and go out, because I really think that you're safe. Don't worry. I mean, basically, if you masked up and you're vaccinated, you're as safe as anybody can be.
But let me ask both of you, zero COVID is clearly a myth, but Omicron is not. It's the third wave, but it's the seventh variant, and it won't be the last. Both of you have expressed optimism that the virus will mutate and get weaker. But there are those kind of paranoid people or worried people who say it may get stronger. What will we do if there's another variant? Dr. Shetty, your thoughts, and then Kiran can have the last word.
Barkha, you must realize that this country today is truly a blessed country for people who are going to suffer from COVID. because the first of all, medical community is very well prepared to manage. We have fantastic infrastructure in both public and private hospitals. Most people are vaccinated, and every material what is used required for managing COVID is freely available. And we have, even if God forbid a repetition of the Delta happens, you will never come across what we went through during the second wave. We are in a much better position. The every infrastructure, thanks to the most of the government initiatives, has finally put everything in place. So God forbid, even that situation happens, it's not going to be the end of the world. We are going to manage it, and we will emerge successfully. I have no doubt about it. So there is no point in losing our sleep, saying that the next variant can be worse than Delta or whatever the we can describe. We are better off today than what we were. We can face any type of COVID wave if it comes.
That's such an important message from you, Dr. Shetty. I know a lot of people in the audience will feel much better hearing it. Kiran, last word to you.
I think we are Atmanirbhar in every way in terms of COVID management. I just think we need to now go out and go about our daily lives with confidence and feeling safe. That's what my view is. We have to get back to normalcy.
Yeah, I always say that there's no point saving lives if we can't actually reclaim the very idea of life itself, the very purpose of life. We're saving lives for a reason, and I think it's been such an educative experience listening from both of you. I hope your confidence, your optimism, your focus on science is going to offer a lot of people hope. Dr. Devi Shetty, member of the Supreme Court Task Force, Kiran Shaw, chairperson of Biocon, pleasure, learned a lot. Take care, and the motto, the message is mask up and live and listen to the science, not to rumors, not to anti-vaxxers, not to fearmongers. And Atmanirbhar on COVID management is a great lesson to end with. Kiran and Devi, thank you so much. Take care. Goodbye.
Thank you.
Thank you. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.